got it. Let's call the Board of Public Health meeting of Tuesday. Oops, this is the wrong day. It says Tuesday, October 26th on the agenda, but today is Tuesday, November 26th. No, it's October 26th. It's October 26th.
October 26th.
All right, good.
Oh my goodness.
Is it Christmas yet? October 26th at 6:33 p.m. Welcome, everybody. So we have a relatively quick agenda. The primary reason that I wanted to have this meeting was because, according to the public health order, we review the public health order monthly based on the status of Plymouth County and Norfolk County and the status of cases in Cohasset. So where do we stand at this point?
We're still, well, in terms of the counties, as Robin. Mary, do you know, can you inform them at this?
Yeah, so Norfolk County is still at a substantial rate. Plymouth County is high, Suffolk County is high. So we're substantial, but the counties around us are still high. And then in terms of our case count, our case count has been creeping up. Our infection rate last week is 3.31%. So that's where we're at.
How many active cases do we have in town?
Yeah, so 19 over the past 2 weeks.
Okay.
And
so
this week the number will be 16. So we're still above the 15 metric, right? So,
okay, so we're still above the threshold for the public health order, so that should stay in effect according to the way it's written.
I don't know if you saw today, DESE, the Commissioner Riley came out with the mask mandate that DESE's put in place has been extended to January 15th. So
got it.
And that's for everyone.
Yes. Yep. Schools K through 12, vaxxed or unvaxxed, teachers and students. However, if you've been, approved for the waiver, then you can take your mask off. But for everybody else, they need to wear a mask.
Oh, so the waiver still
An option.
is still an option.
Yep.
Yeah. We got close, apparently.
Very close.
We got close, and then so DESE approved it and then rescinded it because the middle school shares a building with the high school, and so the numbers came down. But the school committee was ready to act. Again, that's in line with what we agreed to on the public health mandate. So all's well that ends well. Hopefully, hopefully that will get. Hopefully, once they're talking about being able to vaccinate kids under 12, eventually the pace will pick up, and hopefully we'll be in line with being able to relax the mandate, or the school committee will anyway.
I think it gets us to a good point too, where, last year we peaked after Thanksgiving through December, January, so I think this is a real good safety measure to get us through that. We'll see.
Yep. Okay. Anything else on COVID while we're here?
Yeah. So did you see? All right, go ahead, Dr. Schubert.
So Paul Schur, 155 Sawyer Street. Two quick things. The FDA advisory panel voted tonight. I think it's about 4:30. They voted 17-0, 1 abstention, to approve ages 5 to 11 the Pfizer BioNTech vaccine in a day 0 and day 21 2-dose regimen using a 0.1 microgram dosing. So the pediatric dosing, that's going to go to the full FDA probably tomorrow. On Thursday, the CDC ACIP will meet. I suspect they'll also recommend it. Pfizer has agreed to already ship it starting sometime tonight or tomorrow morning. I suspect within 2 weeks that should be available under emergency use authorization. And the other quick thing at South Shore, the numbers have been flat for about 2 weeks, anywhere between 17 and 22 total COVID cases. Maximum we've seen in the ICU has been 6. This morning there were 2. So it looks like we're okay for the last about 5 weeks. That's it. Over.
That's good news.
Yeah, that's very good news.
All of it. Thank you for that update. Breaking news from the FDA. I love it.
So the other thing, we were on a call today with DPH, and we learned that we can now order Moderna to do booster shots. So we're gonna meet tomorrow to talk about that. And hopefully we can vaccinate the people that we vaccinated in the spring. So, our vulnerable elders, homebound, 60 Elm Street. So first responders. So that's our plan. We're gonna meet tomorrow.
And this is using this, and those folks had their first 2 doses with the Pfizer vaccine, yeah?
No, they were Moderna.
Moderna, okay, got it. Good,
Yep.
great. Great. Okay, thank you, Dr. Schubert.
Yeah, one other quick thing, the boosters can be from any option. So if there are Moderna options available, that can boost both the J&J at 2 weeks, but also can boost Pfizer at 6 months plus a day, or Moderna as well. So that's an option for anyone who got Pfizer in town. That can always get a Moderna booster. Over.
Great. Okay,
Then finally, Michael, did you see that I copied you on a letter today that went out to Jenna Cunningham, who had been requesting, like through Freedom of Information Act, information on the number of cases we've had and breaking it down by vaccinated versus unvaccinated. And so that went out today. We had from September 1st to mid-October, I think it was October 13th, we had 40 cases, of which 15 were unvaccinated and 25 were vaccinated. Mary, would you say by and large people were not hospitalized, or?
Yes.
Okay.
Yeah. Yeah.
I think the purpose of that information is to eventually, when say the schools reach their 80% limit, I mean, the 80% threshold of vaccines, and then the only people left wearing masks indoors are unvaccinated children. I think that will be part of the lines of evidence of why the unvaccinated could take off their masks. So just to give you a heads up.
maybe that may be true. I think it will be interesting to see, though. I'm pretty sure DESE is not going to lift their requirements, and I'm fine with again continuing. I personally would be fine continuing to defer that guidance from the state. Anytime they're going to provide guidance from public health, I'm like, let's not reinvent it.
Right. No, exactly. So I think the DESE takes us through into January, mid-January, and chances are January is when all the cases peaked last year. I would think it would probably be the same this year. So I would think local decisions wouldn't even begin until probably springtime, if that. But anyway, just wanted to give you the update.
Got it. Great. Okay, other COVID type topics to discuss?
I don't think so.
Not really.
Okay, that's good.
Plugging along with it.
Yeah, as Pam mentioned in an email to a parent earlier today, we're learning to manage it, right? We have to learn how to manage it because this is going to be around. It's the kind of thing that it's just not going to. It's not an eradicatable kind of disease, it seems, at this point. So
right.
We're doing the
And
best
there
we
has
can.
been a lot of progress made. I mean, kids are back in school, events are happening. It's just that, we have to use certain measures to keep it all going.
Right, exactly. So, okay, great. Okay, so let's look to schedule our next Board of Public Health meeting. So today is October 26th. There was the one was it the septic
Yeah.
case?
So what's going on is that that engineer, Tim Power, he has to appear before conservation.
Mhm.
And the problem is he's splitting a property into two, or he's trying to split a property into two. And the only way that's going to work, because each property needs a septic system, one up here and one down there, and the well kind of goes in between to get the proper setbacks. And from a health perspective, that's really important. You need a 100-foot setback to the well from the septics. The problem is with the location that's there, he's within 50 feet of a wetland. Now, honestly, from a human health perspective, that doesn't really matter, but conservation, I don't see them letting them have it. Honestly, the new agent had a preliminary conversation with her board and I don't think they're gonna give it to him. So,
So can I just interrupt? I have Robin on the phone and he wants to come in on one of our phone lines. Does anyone know how to do that?
You mean on one of the Zoom phone lines?
Is that what you mean, Robin? One of the Zoom?
I
phone
think he
lines?
just calls it.
Oh, so like if I put you on speakerphone, is that what you mean? Okay, I'll do it. All right, hold on. Okay, he's on my phone on speaker because his computer has locked him out.
Oh,
Right,
no.
Rob? Are you there, Robin?
I'm here. What's
Okay.
happening?
Hey,
Can everybody hear
Robin.
me?
Hey, Robin.
Hi there. Hello, everybody.
Okay, so then Pam, then we shouldn't be planning dates around that particular case. So do we
Yeah.
just look a month out from where
so
we are
he,
now?
yeah, so his date with Concom, I think, is November 4th. So our next meeting is probably the end in November anyway, so there's no sense scheduling around him.
Okay, how do you feel about November 23rd? Is that week? Is that week
That's
okay?
Thanksgiving week, though.
Yep.
So,
You want to do
to
before
do
that?
Yes,
Okay,
have-
so how
potentially.
we- do we feel about the 16th?
I can do that.
That's,
Fine by me.
that's the next meeting, Robin, the 16th of November.
That's fine. That'll work.
Okay, 6:30 again?
Yes, please.
All right, awesome. So 6:30 PM on Tuesday, November 16th. Done.
Okay.
Great, thank you. One of the agenda, just out of curiosity, we used to pass around the warrant to sign. I just realized we used to do this like at every monthly meeting. I'm assuming people are getting paid. Like you don't need us to actually sign stuff. Is that true?
Yeah, so that was really kind of like an old fashioned leftover thing. And
Okay.
one day I was talking to the, or Amy was talking to our, what is it, whatever, our money guy. And he was like, why are you people still doing this? And so we abolished it. So now just I sign
Okay.
off on it.
I'm good with that.
Yeah.
Okay, so the meeting minutes for September 1st and September 28th, 2021. Any comments or edits?
Also, that we accept the meeting minutes for the 1st and 25th September.
Okay, I will second that motion. All in favor of accepting the meeting minutes from September 1st and September 28th? Vote by saying aye. 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 Okay, motion passes. Meeting minutes are accepted. Thank you. Public health agent report. Thank you, Pam, for your written report every week. Is there anything you'd like to highlight tonight?
I mean, it is really great news that we're getting this public health excellence grant.
That's
We
great.
have a
Amazing
meeting about
news.
it tomorrow. It's really slow. Like I still haven't got a signed contract from them yet, or I haven't been able to sign a contract. But it's interesting. We've had meetings with this with our town social worker, Stephanie Saunders. She only works like 10 plus hours a week, like 12 maybe or something. She works through elder affairs, and it's interesting to hear what she has to say. And I think one of the things we may be doing with some of the money is helping to support her needs. It would really be helping the most vulnerable people in the population. And that's really kind of the point of that whole grant. It's supposed to be to fill in gaps. And they do want you to target, whatever the most vulnerable population is. So, we'll talk to the other towns and see how it's going to work. Initially, we had that we were going to hire like one worker, like a, they call them like a community health worker, but it's basically like a social worker. But I just didn't see how we were going to split that amongst 4 towns. But maybe what we'll do is break it off into smaller chunks, and and we'll address our needs in Cohasset and so on the other towns. So We'll see. It's gonna take us a little while to figure out how to do it, how it's gonna work with sharing services, but I don't know. We'll see down the future. It's good news though. It's a good problem to have.
Yeah, that's fabulous.
It's a lot of hard work. Excellent.
Thank you.
Thanks. Mary, Public Health Nurses Report?
No, not too much to report. We're wrapping up flu. We're supposed to have a clinic tonight, but we're having it Thursday night. We're down to 130 doses out of 450. So we're in pretty good shape to use that up. And then COVID, we're going to start planning COVID booster clinics. So that will be the next big thing on the horizon. And other than that, just a lot of work with the schools, and there's just a lot of issues with the kids in school, and the test and stay program, and would they qualify, and just there's all kinds of things. So that's always busy. The test and
So
stay.
Mary, with the COVID booster, which vaccine will you be offering?
We're going to offer Moderna
Okay,
because
and that's okay if people had
yes,
Pfizer
yeah,
previously?
yeah. If they had Pfizer or if they had J&J, you can boost them with Moderna.
Okay, good. Thank you.
Yeah. So
When you say test and stay, I didn't know the schools were doing that.
So they are not currently doing it, but they've applied to participate. They haven't
I
been
see.
approved yet by DESI, but it's complicated because test and stay only applies to in-school transmission. And right now we don't have any, we haven't had a lot. So it sounds good, but in reality, it's, I think, a small number that you would be testing. So
Did they
Yeah.
just decide to apply? Because I just read an email from Patrick Sullivan saying why or I think it was him, why they're not doing it.
my understanding is they've applied and they haven't been approved yet to do it. So. Yeah. We'll see. I know some other towns are doing it. Hingham's doing it, and it's a little challenging. So I don't know. But there is a lot of pressure for the school to do it.
Which is, I mean, I guess it's understandable, but, again, as you say, the value of it is really
Hmm,
in cases where you have in-school transmission. We've never had that.
We don't have, right.
I mean, now, if they lift the mask mandate, maybe we'll have a different story. We'll have a different opinion about that, I would think.
Right.
But
So
Well, apparently,
everything
the
I-
next Saturday, we've been given permission to unmask. Is that correct? We
Hmm,
reset 80% threshold.
Yeah, well,
Correct?
they
so
have
what?
not been given permission.
The school department, Robin, applied to the state based on their vaccination rate for the high school. And DESI originally approved it. But then then like 3 hours later, DESI realized that the middle school and high school are actually in the same building. And so they rescinded that approval. So everyone's still under the mask mandate from the state.
Okay,
Okay,
okay, good.
thanks. Anything else, Mary?
No, that's it.
So Mary, is Thursday the last clinic you have planned at the moment?
Yes.
Okay.
Yeah. But it's always good to have a few doses going into like November, in case things sort of, you just never know. I've run clinics in mid-November and you get rid of all that leftover vaccine. So,
And it's going to be at the same place that it was supposed to be today.
yeah, Wilcott works out really well there.
And
Are
remind
you
me
gonna
of the time
send your
again.
mom there, Lynn, or something?
No, I'm thinking of going myself.
Oh, good.
Oh,
Now that I
yeah.
work remote, I'm like, I don't want to go into MGH for my shot.
Yeah, come
Yeah.
to Wilcott Commons.
It's
What are yours?
This is town.
5 to 7 at Wilcott.
5 to 7. Okay.
Yep.
And what ages do you do? Do you
Do 9 years and older.
9? Okay. Oh, huh. All right. Take my whole
There you
family.
go.
It sounds like a Doxy family outing.
Right.
Great, thank you, Mary.
You're welcome.
Any other business? I have no chairperson's report. Does anyone have any other business?
No?
Okay. Could I get a motion to adjourn then?
I'll make a motion to adjourn.
I'll second that. All in favor? Aye,
Aye.
aye. Excellent. Have a great evening, everyone.
Night.
Thanks, you too.
See you
Bye,
later.
Robin.
Pam, can you hang on for 1 minute?
Sure.
Just,
Yeah.
just real quick. I have something I want to ask you.
Are you done recording?
Yeah,